Hello, everybody. Good afternoon. Welcome to the Senior Center, and thank you so much for all of you to be here for this important, informative presentation, which is being done today by our SHINE people, serving the health information needs of everyone, in case you didn't know what that meant. But we are interrupting this regularly scheduled activity for just a few moments to also honor someone that we all know and love, Norman Tetreault, who is here today, luckily for us, but also has retired from coming to Scituate on a regular basis to counsel all of you. And we really had wanted to acknowledge and honor and celebrate all the work that he's done for us for the past 7 years and for many of you. So we didn't think anyone would mind if we did this when you were all here to help us celebrate and enjoy it. So anyway, Norman has been someone, he not only has helped all of the individual clients, but even as a staff has educated us insofar as he could to try to help as well, to support him. And I think oftentimes he's been the first face for a lot of people coming into the Senior Center, and it's been a good one. So people have always been pleased and left here with that feeling that we were able to do something for them, and for that we really thank Norman. So for honoring him, we also are lucky to have both Patrick Kearney, our current state representative from Scituate, and also Karen Conley, our Board of Selectmen representative member, to present him with some commendations that he should receive. So I'm going to let them do that.
Thank you, Linda. Hi, everybody. Good afternoon. I see a lot of familiar faces out there, but for those of you that don't know me, I'm, as Linda said, the state representative for Marshfield and Scituate. And as all of you know, Norm, for the last 7 years, has given over 1,000 hours of his time to help everyone in the community. And as we in our legislative offices try to help constituents with a variety of different issues, Norm is really on the ground. He's the first line of defense, you could say. He helps people with health care, with enrolling in state programs that we're promoting, helping people with anything that they need. So we recognize all the work that you do for this community. We're eternally grateful for it. And I wanted today to give you a citation from the Massachusetts House of Representatives in recognition of all your hard work. So we have the opportunity to read into the record recognition of certain constituents that do a lot of work, that do something above and beyond what everyone else does for the community, and we know that you for a long time have been going above and beyond for us. So I want to present you with the citation and say, be hereby known, the Massachusetts House of Reps offers its sincerest congratulations to Norman in recognition of his unwavering commitment as a volunteer to the Scituate Senior Center. The entire membership extends its very best wishes and expresses the hope for future good fortune and continued success. So Norman, thank you so much. I'd like to welcome up our newest selectman, Karen Conley, and my friend.
Thank you very much, everyone. I see Joe Norton's here, former Board of Selectmen Chair, longtime member. He probably feels, as I do, that this is probably one of the honors that you have as a member of the Board of Selectmen, to be able to honor people such as Norman for all the wonderful work they do. We are so lucky as a community that so many people care so much. I will tell you a quick anecdote. My sister-in-law, who just turned 65, went to sign up for Medicare, and she said to me, Karen, and she has an MBA, mind you, it's pretty complicated. So I said, oh no, I was about to turn 65, and then I had my own experience, and it is complicated. So to have a resource like Norman to help people, and what I've heard is that he saved people hundreds and thousands of dollars in helping them do their Medicare sign-up, enrollment, and re-enrollment, and all the other things that go with what I'm about to find out about keeping up with what's going on. So I'm very honored to read this proclamation from the Board of Selectmen, and thank you very much. I have to take my glasses off to read it. Resolution. Whereas we are gathered this day to recognize and honor Norman Tetreault, for his 7 years of service to the Scituate Council on Aging as a volunteer SHINE counselor. And whereas the Board of Selectmen, Council on Aging and Senior Center, and COA Board of Directors would like to publicly recognize, honor, and thank Norman for his countless hours of service and for his strong commitment to the older adults of Scituate, Mass. And whereas Norman has volunteered over 1,500 hours, more than 1,000, of volunteer service on site at the Senior Center and often on his own time over these 7 years in supporting the Senior Center and Scituate's older residents in painstakingly reviewing and guiding them in the most appropriate and cost-effective Medicare, health, and prescription plans for their individual needs. And whereas we rely on the dedication of volunteers who choose to devote themselves to the needs of our older people by contributing to their quality of life, healthy aging, and ability to live independently, and we find that Norman embodies all of these ideals. And whereas acknowledging our community and senior center is a better place as a result of his considerable efforts and knowledge, delivered with compassion, patience, understanding, and kindness to all of our residents who have come to us with questions, concerns, or imminent need. And therefore, be it resolved that Norman Tetreault accepts this resolution with the sincere gratitude of the Board of Selectmen and all of the residents of the town of Scituate. Your caring spirit, dedication, and knowledge of the legislative and complex industry guidelines benefiting our older adults, and the importance of proactively educating and effectively saving seniors thousands of dollars in medical expenses. Signed this day of September 17, 2019, by the Board of Selectmen of Scituate.
Thank you so much. So in addition, and all of you get to enjoy, we do have cake. So once the presentation is over, we will have some refreshments and cake in Norman's honor. And then I will also just mention, I'm not sure if Jill's in the room, but Jill Johnston, our own Jill Johnston, has been working for the town of Scituate for 15 years and does receive a gift and her very own cupcake.
Oh.
In the and otherwise, I am going to turn things over to Norman, and we have Peggy McDonough, who was the former regional director of SHINE, and she has volunteered to be here to provide you with information herself, and then also Jenny Gervis, our outreach coordinator, who many of you know as well. So you've got the whole team. So here we go. I'll let them take it over.
I'm just here to look cute.
Cute up here with me.
So I'm Peggy McDonough. I was the regional director of the SHINE program, and then I retired because I started at age 12, of course. But, so now I'm volunteering. It's a great program. Once we're in it, we can never leave it. Norm knows this. So.
Yeah.
I've been doing this for 26 years, and Norm, how many years?
This will be my 10th.
10 years. So you can see that there's a lot of experience here with us. We're here because this is Medicare's open enrollment period. From October 15th, that's when it started, to December 7th. This is the time of year that you can make changes in how you get your Medicare. And you know, Medicare, like any other insurance, changes from year to year, so you always want to pay attention to it. Most of you, and if you don't have it, it's coming, have a packet in front of you of information. Now, before I start, I just want to make the comment that some of the costs that you see in here for Medicare are 2019 costs. I always find it interesting that Medicare sends out a Medicare and You book that says 2020 but has 2019 costs. Go figure. So the first sheet in your packet really gives you a description of how Medicare works. And most of you, I assume, have been on Medicare, so you have some familiarity with how Medicare works, and you know it's confusing. But there are two ways. I'm going to do a real quick Medicare 101. Two ways to get Medicare. Original Medicare includes A, hospital, and B, medical. And that's what your card says. Your Medicare card says Part A, hospital, Part B, medical. The other way that you can get Medicare is through a Medicare Advantage plan. And that's Medicare's managed care option. That would be a Medicare HMO or a Medicare PPO. If you join a Medicare HMO or a Medicare PPO, That plan is providing you all that you're entitled to under Part A, hospital, and under Part B, medical. And the Medicare HMOs and PPOs can include Part D, the drug piece. So you have everything rolled into one place. And there are pros and cons of doing one versus the other. If you have original Medicare, you can see any doctor, any provider, any hospital, anywhere in the country. You don't need referrals and you don't have co-pays. That's the good news. The bad news is that there are big gaps in original Medicare. And under Part A, the big gap under the hospital piece, if you go into the hospital and you have Medicare Part A and Part B only and no other insurance, you're responsible for a $1,364 deductible in 2019. It'll go up a little bit in 2020. That's the big gap in Part A. The big gap in Part B is that Medicare pays 80% of the cost after you've met your Part B annual deductible, which this year is $185. That will go up, of course, a little bit in 2020. Medicare pays 80% of the cost, and you're responsible for the other 20%. Those are the big gaps. There are some other gaps, but those are the major gaps. So in your packet, a few pages back, you're going to come to a sheet that says 2019 Medicare Part A benefits and gaps. It's 4 pages in. It's the 4th page in.
Excuse me, do you have any more of those?
They're coming.
Oh, sorry.
And this tells you the gaps in Medicare that I just mentioned. And it gives you the services. So as I mentioned, hospital, if you go into the hospital with Medicare A only, or Medicare A and B and no other insurance, you're responsible for $1,364 deductible. Per 60-day benefit period. It's not an annual deductible, it's per benefit period. So if you're in the hospital for a week, you have that deductible to pay. If you go home for a week and go back in, you're still in the 60 days, you don't pay it again. But if you're home for 90 days and go back in, then you pay it again. So that's a biggie. On the back side of that is the Part B benefits and gaps. Medicare 2019 Medicare Part B benefits and gaps. And this tells you doctors and outpatient surgery and things like that are covered under Part B. And once you've met the Part B annual deductible of $185 in 2019, Medicare will pick up 80% of the cost and you'll be responsible for the other 20%. So some people choose to stay on original Medicare because they want freedom of choice. They don't want to have to worry about networks or referrals, or maybe their doctor that they have been with for many years doesn't contract with any Medicare Advantage plan, so they want to stay on original Medicare. So on the next page of your packet is a list of Medigap insurance. And here in Massachusetts, we have 7 companies selling Medigap insurance. And Medigap insurance is not Medicare. It's private insurance that people who have Medicare A and B buy to fill their gaps in their Medicare. There are 3 plans listed here. Core, you'll see the heading at the top, Core, Supplement 1, and Supplement 1A. Supplement 1A is a new plan that will be sold as of January 1st. But right now we have Core and Supplement 1. And for ease of understanding, most people in Massachusetts are familiar with Blue Cross Blue Shield, most people on Medicare anyway. Blue Cross Blue Shield Medex is what they call their Medigap plans. So for instance, Supplement 1, Blue Cross calls that Medex Bronze. If you have a Supplement 1 plan, either with Blue Cross or any other company, a Supplement 1 plan picks up all the gaps in Medicare, the hospital deductible, the Part B annual deductible, the 20% for doctors, additional days in the skilled nursing facility, so it picks up all the gaps. You need no referrals, you have no office co-pays, but it's not cheap. And it does not include drugs. So if you do original Medicare, you need a Medigap to fill those gaps, and you have to buy a separate standalone Medicare prescription drug plan, Part D. So that's one way to get your Medicare. The other way to get it is through a Medicare Advantage plan. My Medicare Advantage plan chart is in color, which makes it much nicer. Unfortunately, yours is in black and white. I have no control over that. I'm not the director anymore. And so it looks like this, except yours is in black and white. And this lists the Medicare Advantage plans available. They're coming, they are coming. If you could look on with someone else, that would be lovely. I apologize. I brought 20 and it wasn't quite enough. So these are the Medicare Advantage plans. It can be a Medicare HMO or a Medicare PPO. And by the way, no matter what you get, however you get your Medicare, you still pay for Part B. Whether you're in original Medicare or you're in one of these, you still pay for Part B. It still gets deducted from your Social Security check. I'm not going to go through all 12 pages of this. You'd be asleep and would miss out on the cake. So I'm just going to cover a few of these. So on the front page we have Aetna, and I'm going to show you how to read across this chart. So it makes sense to you, because when you first look at it, like much of Medicare, it looks like gibberish at first. So this plan, the company name is Aetna, and the plan of this top plan is an HMO. Now you know an HMO requires that you stay in network. To go outside of network, you have to have an authorized referral. If you're in a Medicare HMO and you go outside of network without authorization, the HMO won't pay and Medicare won't pay. Nobody will pay. So in an HMO, you have to stay in network. The company is Aetna. The plan name is Aetna Medicare Value Plan HMO. It has a 0 monthly premium, no monthly premium, and it includes drug coverage. Now you saw what the Medigaps look like, so it has an annual out-of-pocket max of $6,700. That doesn't mean that that's all the coverage you'll get. That simply means that you spend out-of-pocket $6,700 in a year on health care, doesn't include drugs, just health care, then from that point on, you wouldn't have any other costs, co-pays for health care. You would still have your co-pays for drugs, but not for health care. So let's move to the next column. It's the RX deductible. The plans this year can charge any Part D plan, because the drug coverage in here is Part D, so this includes your Part D. The Part D plans can charge a $435 deductible. Some of them charge that, some of them don't charge any, some charge less. This plan charges a $250 deductible on tier 3 to 5 level drugs only. If you're in this plan and you take a tier 1 or tier 2 generic, they don't impose that deductible, so you'll get coverage right away. They also provide a $50 per quarter for over-the-counter medication. Aspirin, other things that are over-the-counter that Part D does not cover. So they provide a $50 per quarter benefit. Doesn't carry over from quarter to quarter, but that's a nice little addition. Now the next series of columns are the co-pays for drugs. So we're on page 1 of this. If you're having trouble staying with me, we're on the bottom of the page. Luckily I numbered them, so it says page 1. So we're looking at Aetna. Now we're going to go across that top section. Tier 1, if you're in this plan and you take a Tier 1 drug, a 30-day supply of a Tier 1 drug at a preferred network pharmacy, no copay. Tier 2, $5. Tier 3, $47. Tier 4, $100. Tier 5, 28%. To see a primary care in this, you pay $20. To see a specialist, you pay $50. For physical therapy or occupational therapy, you have a $40 copay. Not bad so far. No monthly premium. Not bad, this coverage. But if your copay is low or 0, there's going to be some cost somewhere in this plan. And the next column is where the cost comes in. If you go into the hospital in this plan, from day 1 to 5, you have a $390 per day copay. If you're in there for days 6 to 7, you don't pay it on those days. But day 1 to 5, you have this copay. If you're home for a month and you go back in, it starts all over again. So that's where the cost comes in. In most of these lower cost plans, you'll see it in the hospital copay. Outpatient surgery services, $350. Diagnostic services, $20 for lab, $30 for x-ray, $125 for diagnostic radiology. Emergency room, $90. And if you go into a skilled nursing facility in this plan from day 1 to 20, you have no copay. From day 21 to 100, you have $178 copay. Medicare provides nothing more than 100 days in a skilled nursing facility within a benefit period. Now, this plan provides some dental, some little hearing, and Medicare doesn't cover those things at all. No dental, no hearing, no eye care under Medicare. Nothing routine. You can get corrective lenses after cataract surgery with Medicare, but not routine. So they provide a dental benefit of $125 a year. Not much, but you're not paying a monthly premium for this, so you have to look at all these. The hearing, no copay for one exam a year. Hearing aid, your copay can be 0 to $1,700. The benefit can be 0 to $1,700, depending on the hearing aid that you get. It has to be through Hearing Care Solutions, and no copay for one vision exam a year. Now, the difference in this and original Medicare with the Medigap is if I join this, I stay in network. Because when I join this, I'm telling Medicare, this is how I'm going to get my Medicare, through this Medicare HMO. And if I do it during open enrollment, I'm pretty much locked in. So that's why we say this time of year is important for you to make a decision about how you want to get your Medicare, because you're pretty much committed to that then for the rest of the year. There are some ways you can change, but generally you are. The next plan down of Aetna is a PPO, and a PPO allows you to go outside of network. I'm sure most people are aware of this. It allows you to go outside of network, usually at higher copay costs. So again, this is a zero premium. Similar in terms of the gap, the deductible. The drug coverage is a little higher, the copays for drugs a little higher. But let's go over to primary care. You see a primary care in-network, you pay $5, out-of-network $25, a specialist in-network $45, out-of-network $50, PTOT $40 in-network, 45% out-of-network. Hospital, day 1 to 7, $295 in-network, 45% out-of-network. 45% of what you don't know, what that hospital bill is going to be. Makes me a little bit nervous. Let's turn to page 4. Page 4. Hopefully, I know that your copies, now again, I'm just the messenger. I didn't create them, I didn't make the copies. Your copies on some pages have the heading from the previous page on the bottom of the previous page, so they're a little messed up. But hopefully the numbers are where they're supposed to be, I hope. So page 4 is Blue Cross and Blue Shield Medicare HMO. Now, the other thing that adds confusion to this is that some of these companies, like Blue Cross sells Medigap, they sell Medicare HMO, and they sell Medicare PPO, and they sell Part D. So when we say to someone, what's your coverage? Oh, it's Blue Cross. Well, we have to figure out, narrow it down to what kind of Blue Cross. Actually, let's move over to page 5, because this Blue Cross has some PPOs that I want to point out to you. So page 5, the plan on the top is Medicare PPO Blue Saver RX. Are you all with me? Yes. Zero premium for this. They impose a $405 deductible, again only on tier 3 to 5 drugs. If you take tier 1 or 2 generics, you don't face that deductible. The copays for tier 1 are $4. Again, this is a 30-day supply at a preferred network pharmacy. $10 for tier 2, $42 for tier 3, $95 for tier 4, and 25% for tier 5. To see a primary care, it's $25 copay. To see a specialist, it's $45, PTOT 40. Inpatient hospital, again, this is a zero premium, so this is where the cost is going to be in the hospital. Inpatient hospital, day 1 to 5, $350 a day copay. Outpatient surgery, $300. $10 lab, $10 x-ray, $325 high-tech radiology. In a skilled nursing facility, now what I want to point out is so far there's no difference. There's no in or out of network in this one, and it's a PPO, allows you to go out of network. Usually you pay more. This doesn't impose higher cost out of network until we come to a skilled nursing facility. There they do, but prior to that, whether you see a doctor in network or out of network, you're not going to pay any more. You're going to pay the standard copay. The skilled nursing, day 1 to 20 is 0 a day, 21 to 44 is 160 in and 20% out. And this plan also offers some dental, no hearing aid, and no vision, just some dental. That's their zero PPO. If you go down to the bottom of the page, this PPO costs $262 a month. It has a $200 deductible on tiers 3 to 5 only. Tier 1 is $1, tier 2 is $5, tier 3 is $42, tier 4 is $95, tier 5 is 25%. Now here, the in and out of network comes into play. If you look at the primary care, $15 in network, specialist $35 in network, PTOT $15 in network, 20% out of network. For a primary, $45 out of network. For a specialist, $45 out of network. Inpatient hospital, day 1 to 5, $150 a day in network, 20% out of network. $10 lab x-ray, $150 for high-tech radiology in network, 20% lab x-ray out, 40% high-tech out. So again, that always concerns me because especially around the hospital, you don't know what you're paying 20% off. You don't know what that bill is going to be. So that always makes me a little nervous. I just find it interesting that their lower cost PPOs don't have that in and out of network. Around the hospital, that's a big deal, I think. Excuse me. Now, one more thing. In the past, I would say to people, sometimes people will meet with us and they'll say, well, I want to join one of these because I want dental. In the past, I'd say, don't choose a Medicare Advantage plan for dental. That isn't a good reason to choose it. But that's starting to change because now this year, for the first time, we're seeing a much improved routine care services. So if you would turn to page 7, I swear I won't make you do every page. We're almost done. These are some Harvard Pilgrim plans. And they have a zero premium plan, that's the top one. They have a $67 plan, that's the middle one. And they have on the bottom, $168 plan. And when you're home and this stuff is so interesting that you want to read over and over and over these pages, you'll get a chance to see the difference in the cost. If it's a zero premium, there are going to be higher out-of-pocket costs in the plan. As the premium goes up, the out-of-pocket lowers. But even in their zero premium plan, they provide $500 a year for dental. Hearing, $40 for one exam. A hearing aid copay, $6.99 to $9.99. Vision, $0 for one exam. Their most expensive plan, they give $1,000 a year for dental. I mean, if you buy a separate dental plan, often that's about the maximum benefit that you're going to get. So this is, this is much improved from what it ever was before. So we're very happy to see this stuff. And in this particular company, and some of the companies, on the bottom of the page, under the box, it says they offer what they call an annual wallet benefit. Now you remember that Aetna offered a $50 per quarter for over-the-counter drugs, things that Medicare doesn't cover. So this is another way that these companies handle that. They have an annual wallet benefit that can be used to cover cost of eyewear, fitness membership, and alternative therapies. Somebody wanted to get acupuncture, for instance, not covered by Medicare. And the benefit is $250 in the zero premium plan, the basic plan. It's $325 in the middle, the $67 a month plan, and it's $400 in the $168 plan. So, what we're seeing is that these plans are improving to entice people. They really are improving what they're offering overall from what they used to offer. Any questions? not a 1, yeah.
There was something on TV, there's still got much on now, when it was like research or something, was Medicare C, what's that?
That's this, Medicare Advantage is Part C, yeah. You know, they want to keep you on your toes, so they don't want to make it too easy for you to figure this stuff out, yeah. Did you want to add anything to this?
No.
Okay,
Excuse me.
yes,
Currently, with the Blue Cross products, the MedX, you can
yes,
move from one
Yes.
product to another and back. So
Yes.
what's the story with that?
that's still the case. I don't know if you heard, so I'll repeat. She asked about Blue Cross, it's true of all the supplement plans in Massachusetts, all the Medigap plans. You can move, they have continuous open enrollment. So that means you can move back and forth. So for instance, let's say I'm in core. Core is cheaper because it doesn't quite cover everything. And the big thing it doesn't cover, the Medigap, the big thing it doesn't cover is the hospital deductible. So sometimes people will go with core to save a few bucks, I don't blame them. So let's assume I'm in core, and I see my doctor on November 2nd, and the doctor says, we have to do knee surgery, Peggy, that knee is bad, so I'm gonna schedule it for the end of the month. And I say, oh, wait a minute, my core isn't gonna cover the hospital deductible. I say to the doctor, no, make it next month, make it December. And I call Blue Cross and say, I wanna go up to bronze. I can do it with any plan, I'm mentioning Blue Cross, but it can happen with any plan, it's continuous open enrollment. I have my surgery, and if I wound up in a skilled nursing facility, which is highly unlikely, because for Medicare to cover at all in a skilled nursing facility, I have to have a pre-overnight stay as an inpatient in a hospital, not be observation, has to be inpatient. Then I go into the SNF within 30 days, and then Medicare will pay in full from day 1 to 20. And then after that, there's a $174 copay, day 21 to 100. If I'm in core, the cheaper one doesn't cover those extra days. If I'm in bronze or supplement 1, it covers those extra days in the skilled nursing facility. So I have my knee surgery, I'm feeling better, it's the end of December. I call Blue Cross and say I want to go up to bronze. Perfectly okay to do that, perfectly okay. And go back and forth,
You
yes.
mean go back to court?
Go back to court, that's what I meant, yes. I'm glad you're here. So somebody needs to tell me what I'm saying. So it's perfectly okay.
I have an Aetna, but I don't ask for Aetna. I used to have my Medicare since 1950. I retired 59. I have my normal Medicare. Then to my neighbor for prescription Aetna show up. The Aetna for me is now good because my doctor moved, I don't have no doctor.
Okay,
I go to the doctor, and the family doctor in capacity don't take me. I got to have a doctor because I have a high blood pressure.
okay,
Doctors will check me every 3 months to call me.
okay. So I assume you all heard that her doctor left the plan she was in, and she needs a plan that the doctor will take. Perfect time of year to be here, because this is the time of year you can choose a plan that your doctor's in. So that's what this is about. One more thing I want to mention, that starting January 1st, there'll be a new Medigap plan called Supplement 1A. And Blue Cross is calling this Medix Sapphire. Don't you love that they used to have Medix Gold and Bronze and Silver and now Sapphire. And the only difference between Medix Bronze, Supplement 1, and the Supplement 1A is that 1A does not pay the Part B annual deductible. Everything else is exactly the same. Any doctor, any hospital, everything else is exactly the same. Only people who are eligible for Medicare prior to January 1 can still buy bronze. So if I had Medicare and continued to work, I got on Medicare in 2019, but I continued to work. I had Part A and I never picked up Part B, and I don't retire and want this until the end of 2020, I can still buy bronze, as long as I was eligible for Medicare prior to January 1. But new people joining Medicare after January 1 can only buy the Supplement 1A. It's a little cheaper, so. Any other questions? Yes.
I saw Rich.
Yay for Rich.
Yeah, but there was a question I forgot to ask him. I might be taking Medicare Blue Value prescription PPO,
Uh-huh,
it's down there.
yeah.
And, am I gonna be covered with dental?
You have to look, because I don't have them all. Blue Value PPO. You have, this one. Yeah.
An exam.
Yeah. All you'll get is an exam. You have a copay of $40 every 6 months. You can get an exam.
Okay, and I
Yes.
get one exam a year?
Yeah, it's probably preventive. You might get exam and cleaning every 6 months. You know, that's just a preventive. Yeah, don't go beyond that.
$40 copay, and then I get a cleaning and a exam.
Yes, that's what I believe it is, yes. But you can double check that with, did you get any material from them?
No, I haven't called them. yet.
Oh, okay, okay.
Okay.
Yes.
I think I misunderstood. Did you say that Blue Cross Bronze covers your Part B payment? Or
Bronze does, yes.
does that?
It covers your Part B annual deductible, which is $185 right now.
Oh, okay.
It'll go up in 2020. Any other questions? Yes.
With the HMOs, is there flexibility that, I think last year you had up until March? so
Yes.
if
God, this is a great group. You've trained them well. My God. Yes, there's, you know, wouldn't it be nice if Medicare just left this open all the time?
I didn't get the question.
I'll repeat it. Wouldn't it be nice if Medicare just left it, you could switch around whenever you wanted, but anyway. This gal asked, if she joined a Medicare HMO, isn't there a period of time when she could get out of it? And that's true. If I'm in a Medicare Advantage plan, that's what these are called, Medicare Advantage, whether it's HMO, PPO, on January 1st. So I have to have enrolled during open enrollment, and it starts January 1st. And January 2nd, I get a letter from my doctor saying, I'm leaving this at the end of the month. I say, oh boy. I can get out. I have until the end of March to get out of that, to join something else, go back to original Medicare, pick up a Part D plan, so I can move during that short period of time. Beyond that, I need something that gives me a special enrollment period, that's what Medicare calls it, to get out of how I'm getting my Medicare. If I'm a member of Prescription Advantage, I know if he was here all those years, you know what Prescription Advantage is, you have to. Prescription Advantage is the state prescription assistance program that acts as secondary payer to your Medicare prescription drug coverage, whether it's on a standalone plan or within one of these. But if you're a member of Prescription Advantage, and for some reason you want to change your Medicare Advantage, or you want to change your Part D plan, maybe you get a new drug and it's not being covered, and you want to see if there's another plan. You meet with the Shine counselor, they find another plan for you, and if you're a member of Prescription Advantage, it allows you to make one switch during the year. If there is a 5-star Medicare Advantage or Part D drug plan, and I kind of skipped over Tufts, I didn't mean to, but Tufts, for the 3rd year in a row, I think, has been rated 5-star by CMS. So if you were in original Medicare and you decided, I don't want this, you know, it's a pain in the neck, or it's costing me too much, I want to get into one of these cheaper plans, as long as it's tough, you can join that at any time. 5-star gives you a special enrollment period. Blue Cross's Part D standalone drug plans also have 5-star rating. So, you know, if you had a drug that isn't going to be covered by your plan, and it's covered under one of the Blue Cross Part D plans, you could join it outside of open enrollment because the 5-star gives you special enrollment period.
Well, I have a tab for 20% Medicare pay, but if you go to the doctor, because I have Aetna take over your protect that.
Well, you know, one of us will talk with you afterwards to address, you know, what the problem that you're having now, the
I have
doctor
a
one.
problem. Thank you.
Any other questions? Yes.
So this new supplement 1A, based on what you said, it sounds like Medicare does want new people to move into it going forward. So do you have the same ability to do the switching between core, bronze, and sapphire?
Did you all hear her question? Can you switch between core, bronze, and sapphire? You have to be in bronze for a year before before you can go into Sapphire. Because what they want to avoid is that people make the switch. Now my Part B, I joined Bronze, my Part B deductible is met, now I'm going down to Sapphire. So they set it up so that couldn't happen.
Is the Sapphire a lower?
It's a little lower cost. Let's go back to that Medigap chart in your packet.
From what I can see, it's only $20 a month difference.
No, it isn't a whole lot.
Yeah,
Big
you save a
difference,
little
no.
bit.
It's not a big difference.
What do you suggest for prescription drug plans?
I can't, I don't. And I'll tell you why.
Okay.
We have 25 plans. And the lowest cost plan costs $13.20 a month. So people say, okay, that's the one I want, it's cheapest. You can't join a plan based on, oh, I like that, that's AARP. Or I like the name of this one, oh, that's the lowest premium. You have to join it based on a search on the Medicare site, which is not fun this year, to find a plan, the lowest cost plan that covers all your drugs. That's what we do. There's no other way to do it, really. If someone new to Medicare was joining, and they were gonna do original Medicare, and they needed a Part D plan, and they took no medication, I'd say just join the cheapest plan. They don't take any medication. But beyond that, we have to do a search for it.
On Aetna, take prescription for high blood pressure. I'm not fine because my sometimes when my pressure high very high. They pay me my prescription.
Okay, we'll go over it with you.
I have a question.
Sure.
On that same issue we were just talking about, if you had no medications, right, and you picked the cheapest premium, what if you got sick within the year and all of a sudden you got hit with a $10,000 prescription?
Well, that is the risk.
You can't change,
That
right?
is the risk you take, but even if you purchase the most expensive Part D plan, there's no guarantee that it's gonna cover your drug either. There's no way of knowing that. So if you were someone in that situation and you met with one of us, we look for a way to see if there's something that would give you a special enrollment period.
So that's, okay, that would be the,
Yes, now that Norman's gone, we have somebody else who's going to be here.
Rich.
I'm Rich.
Oh, I'm happy to know you're welcome.
I've already met with a few people and I have a schedule with Jill.
Yeah, to your point back there about getting an expensive med all of a sudden, that's why, if you can, you should join Prescription Advantage right away, particularly if you can join for free. There are income limits where you can join for free, but if you can join for free, my advice is do it immediately. That way there, if you get hit with an expensive med later on, and the plan that you're in does not cover that medication, you can switch to something else that maybe does a lot better. And there are other tricks, even if you don't qualify income-wise, there are still ways to do the changes, but that's why you want to see one of us in order to do that.
Yes.
So I think I'm on WellCare, is it?
And for your Part D,
Yeah,
yeah.
and so when I signed up, I had very little medications. Now all of a sudden I've got a pillbox.
Ain't life grand?
So I've gotten 2 notices saying, we don't cover this drug, but we're required to give you a limited, yeah.
Mhm.
So is that how it works? They'll pay for it, but you have to find a different drug that's covered, or what happens? You know how that works?
I think they are required to give you at least a 30-day supply.
Right, yeah.
And then what you can do afterwards, if you want to stick with the plan, there's no guarantee we're going to cover it. You can always file for a formulary exception to see whether they will cover it. And in most cases, if they grant the exception, it'll be covered at Tier 4, which is the highest level. So you'll end up paying the full cost of the drug until the deductible is met, and then
So will I have to pay the full cost of the initial prescription, do you think?
If it's a brand name drug and the plan has a deductible, more than likely, yes.
You know, if this is your situation, we'd suggest that you meet with us or fill out the form and get it in, and so we can see if there's another, we'll pass these out. We can see if there's another, you know, company that would cover it.
Okay. Thank you.
Yes.
Do the programs that have a prescription plan, do they all allow you to go through Optum mail away and get 3 months at a time? I get 3 months free.
It depends on the plan. It depends on the plan. Most of them have mail order. It depends on the plan. What the mail order is, and, you know, it depends on the Part D plan you sign up for. But what we have found in the good old days, Part D started in 2006, and in the old days, mail order almost always was cheaper. That's not the case anymore. So sometimes mail order is more expensive than it doesn't always pay. Mhm.
Except I went on a higher level for GERD, and it cost $294.70.
Mhm.
$9.60 a pill. Cute, huh? I got 1 month and went off it.
Does all this make sense to you? No.
When you're switching within Blue Cross, what's the wait period? There must be a wait period.
You mean the bronze? You mean the Medigap? The Medigap, is that what you
Yeah.
mean? Gee, they'll do it within the day, yeah.
Really?
Yeah.
Yeah. Just-
No, I mean, I've had situations in the past, I've enrolled somebody the last day of the month.
Yeah.
The plan will be effective the first of the following month.
Boy.
Everything in Medicare world takes effect on the first of the following month. So even the Medigaps, it's first of the following month. And Blue Cross is pretty user-friendly in that sense,
Yeah.
that you can change the day before, yeah.
Great.
Yes.
I have Humana prescription, thanks to Mom. And so I do mail away, which is great, works out great. However, for Humana, I was having to go to Walmart, which used to be in Hanover. They're no longer
Oh,
there.
that's right, I heard that.
So is there another pharmacy that covers that?
No. But you bring up an interesting point of naming Humana. In 2019, Humana had 3 plans, and if I remember correctly, Humana Walmart, Humana Preferred, and Humana Enhanced.
Yes.
Anybody who's in the Humana Walmart plan this year, next year they're being converted over to Humana Premier. We have 3 new plan names. And the premium is going from $30.70 a month to over $62 a month. So if you're in Humana Walmart, you definitely want to do a Part D search for next year. Because otherwise you'll be spending money for nothing. They do have a new Humana Walmart plan. I think, as Peggy mentioned, that's about $13 a month, $13.20 or something like that. But Walmart is the preferred pharmacy. And I've run into the same situation with another client down here. Her cheapest option would be to go to Walmart. But she doesn't want to have to drive to Weymouth.
Neither do I.
Right, so that the second tier Humana plan, I think it's the basic, it's more expensive, it's $35 a month. It has no preferred pharmacies. So if you went to CVS or Walgreens, the price should be the same, or within a few dollars of each other. But you really need to do a Part D search.
Yeah, I have a different medication now too, so I'm gonna do it anyway.
Right, which leads me to something else. But Humana Walmart, as the name implies, Walmart is the place you're gonna go to get the best prices. Doesn't mean you can't go anyplace else, but Walmart is where you're gonna get the best price. I know you're gonna be shocked to hear this, but the insurance companies have cut deals with the pharmacy chains.
Wow.
Wow. So for example, WellCare has 6 plans this year. They took over the Aetna, so anybody who's at Aetna from 2019 all their plans are being converted over to well care this year. They're trying to put you in a similar plan to what you were in as far as Aetna. There's no guarantee it's the right plan, but again, that's why you need to do a Part D search. So they've got 6 plans. For the most part, I think 5 out of 6, CVS is the preferred pharmacy. But there's one plan, Walmart is the preferred pharmacy. Right, so when we do the Part D searches, we ask you on the back of the form, okay, what pharmacy do you use? All right, so when I'm doing the searches, I've got the option to choose 3 pharmacies. So if you tell me CVS, I'm gonna choose CVS. I'm gonna plug in Walgreens. If you tell me Scituate Pharmacy, okay, I'll plug that in to see what the pricing is. If you just give me one, I'm gonna do Walgreens and Walmart. Though Walmart is gonna be a stretch for the folks down here. I wanna find out what the cheapest pharmacy is. You know, we hope you're flexible enough that you're not married to going down to, you know, CVS down here at the Harborside. You know, if you're looking to save money, you've gotta try to be flexible and try a different pharmacy if it's gonna give you the best price. If you're wedded to a particular pharmacy, well, okay, in that case, we'll try to find you the best plan, the lowest cost plan, we'll say for Scituate Pharmacy, or whatever the case may be.
How come you said that the Walmart plan was going from $30 up to $62, and you said something, there was a Humana Walmart, it was $13, what's with that?
Can I say it?
Go ahead.
Because it's a scam. Right, so that anybody who's in the Humana Walmart plan this year, I mean, that plan has been around for a few years.
Yeah, from the beginning.
Right,
I have it.
right, in the beginning, I think the premiums were $12.70.
Yeah, and each year they've gone like $5.
Right, so they've crept up to about $30 and change, right? So now, Humana would have sent you a notice that said that anybody in Humana Walmart for 2019, they're being placed in Humana Premier. What they're counting on you to do is take that piece of paper and throw it away and not pay attention. So this is why, this is the most important part of the year for anybody who has a prescription plan. You really do have to pay attention.
How do what's the plan that you pay $13, what's that called?
That's a Humana plan. That's Humana Walmart Value RX plan, $13.20.
Value RX.
Yeah, that's the cheapest plan this year, but, you know, you don't choose it on that basis.
Okay.
I mean, if you're taking no meds,
Yeah.
I suppose
That'd be a reason,
that's the
yeah.
plan you want to be in.
Okay.
Right, particularly, we'll say the premium plan is costing $62 a month. It's almost $740 for the year, whereas they don't tell you that about the Walmart, the new Walmart plan, cost you $13, the total cost of the year is $159. But that's why you're gonna pay attention to this stuff.
Got it.
And one other thing that I want to mention, when we do a search for you, we're going on the Medicare.gov website. Not as user-friendly this year as it used to be. If we can do a general search where we don't need very much information from you, we just put your drugs in, but it doesn't retain it. So we can't save it. If we got bumped off while we're doing it and you gave us 20 drugs, that's gone. If we do a search under a general search, and we give you the information that this is what looks like the best plan, and you come back a week later with another drug, we can't go back in, it's gone. So the only way we can save what we do is if we do a personal search. In order to do that, we have to enroll you in mymedicare.gov. So on our form, Norm, clever guy that he is, added a piece where you sign allowing us to do that. Then we can save it, it'll tell us what you have now, if you have any extra benefits, it'll tell us that. And if you came back, we could click right back in it again. And the other thing I want to mention is, we're choosing a plan, looking for the lowest cost plan that covers all of your drugs today. Things change in these plans. They shouldn't be allowed to change. They ought to be locked in at that price that you get, and that should stay there for the year, but it does not. So there's just so much we can do about these things. one more thing I want to mention. If you are on a retiree plan, none of what we're talking about applies to you because you have a group plan, and that's different. This is all non-group we're talking about. If you're a veteran and you get your prescriptions through the VA, you don't have to enroll in a Part D plan. You're not required to. If you decided to later on during an open enrollment period, there's no penalty to you because you had creditable coverage. Anything I left out?
I think you mentioned retirees, so I know in the past there were a number of clients down here who were getting their benefits through Aon. I think the other one is VIA. They're taking care of retiree benefits for people who work for Verizon, I think.
Yeah.
Edison,
And whoever else.
Edison.
Okay, Edison, so that if you are getting a supplement to help pay for your insurance, you have to go through the exchange to enroll in the plans. So for example, I believe it's Aon, I did the search on it recently. Okay, if you went on that plan, you've got a choice of 7 Medigap plans you can choose from. 7 companies who offer Medigap plans. You're going through the exchange, Aon offers only 3 plans. So if you're gonna pick one of them, you have to go through Aon and let them know what the choice is. Peggy mentioned there's 25 Part D plans. You don't have that option with Aon. You've got maybe 18. It's the same thing with the other exchange. I mean, what we can do is that, because I know what plans are available through the exchange, I can still do a Part D search and say, look, if I was in your situation, this is the plan I'd be looking for, but you have to go through the exchange to enroll. They don't like it when we get involved. They don't like it when you get involved. You have to go through them. And that's how you keep getting that money that helps pay for the plans. You've got to go through that.
Yes. What's the easiest way for me to find a list of all the available Part D drug, plans?
You're gonna do your own search?
Well, I don't know.
Have them do it.
Because giving you the list of the plans does nothing for you. It really doesn't. You know, I think in some regions, they mail that list out. I never did, because people would look at it and say, oh, I want that one, it's the cheapest. Or they'd say, I don't want that because it has a deductible. Well, we know that sometimes that deductible isn't imposed because we know what plans, if you're on a tier 1 or tier 2, and what pharmacy, so we can connect all those dots.
Okay.
To give you this, I think, is useless, really.
Okay.
Yeah.
Yeah, the other thing with the prescription plans, these are the only plans where price means nothing. Seriously, right? If you were looking at a Medigap plan, we'll say core versus supplement 1, you can deduce by looking at the pricing that, okay, Blue Cross charges $98 this year for the core plan. They charge $198 for the bronze. I must be getting something more for the $198. Why? No copays, no deductibles. The prescription plans bear no relationship to any reality. Right? So the lowest cost plan could be the best option. Whereas the Blue Cross, their premier is $128 a month. In my 9 years of doing this, I've had 3 clients go on the premier. Right, so just because you're willing to pay more does not mean you get more. It's not the best plan.
So I ended up calling the one drug that they told me was going to cost $300. And I said, you know what, to my plan or whatever. I said, I'm going to call around all these different pharmacies and find out what they cost, but I didn't have anything I had to pay for out of market. You would be amazed the difference in prices. It was like, it ranged anywhere from $50 to $500.
Yes.
You bring up a good point.
Yeah.
Right? You've seen the ads on TV, right, where the woman walks into a pharmacy with her 2 kids to pick up a prescription for one of the kids. And the pharmacist says $68. And she's starting to walk out, and she says, have you ever heard of good RX? Oh, you can get for $8.90. Okay. It doesn't always work. Sometimes, even for people who want prescriptions, like plans, sometimes it is a better option, but not always. I have client Wayne that's her next 3 months supply is $90. Just for the heck of it, I want to do it all right. 3 months supply for the same drug was $30. And the pharmacist was willing to take the coupon, so she can buy off the books, so to speak. But it doesn't always work, but that's another
So that's a
resource.
website, GoodRx?
Pardon me?
It's called GoodRx, that's a website?
Yes.
And it has all the different pharmacies with the same drug?
Well, what you'll do is that you go to the website, and you put in the drug, you tell the machine go, and it'll bring up the list of pharmacies in your area and what the cost is, and you can print off a coupon if you want.
I'm gonna add to what this gal said. I don't know if you all heard her question, but she said that she kind of did some shopping around and found that different pharmacies, same drug had different prices. Several years ago, a fellow called the regional office, and he said, you know, I joined this plan, Shine helped me, and I joined this plan, and when I filled this drug 3 months ago, I paid $50. I'm not sure what the dollar amount was. He said, and I just went to the pharmacy now, and they said, well, now it's gonna be 110, whatever the difference was, 75, it was a difference. So a Shine counselor in the office called the pharmacist, what a very nice gal. And she said, oh, this changes all the time. She said, now I won't name the pharmacy, but it had 3 letters. And she said, this was in the town of Foxborough. She said, if he went to our pharmacy in Lowell, the prices would be different today, from Foxborough to Lowell.
So just like the supermarket.
Yes, same thing, yeah. So yeah, so it's very hard to, you know, connecting these dots is not easy sometimes, yeah.
But another point, anybody here on insulin?
Yeah.
What? Okay, so that, if we go through the Medicare website, it'll generate whatever the results are. And you're probably finding it very expensive. Well, some insulin, particularly if you can buy the vials, as opposed to some of these, as opposed to the pens. Okay, what they don't tell you is that Walmart sells their brand called Rely On. You'd have to check with your doctor to see whether it's comparable to what you're taking. But if you can buy the vial of insulin at Walmart for $25 per bottle. And you can buy it off the books. Right? So it wouldn't go through your Part D plan. So I've had clients who do that in the past. It saves them a ton of money. But it's something you've got to talk to your doctor about to see whether the meds are comparable before you go ahead and do it.
And I'll close with this, just to let you know, that when you meet with us, we're always trying to see if we can hook you up with a benefit program that might help with some of your costs. So, and most benefit programs are driven by both income and assets. Prescription Advantage, assets don't come into play for Prescription Advantage, just the income that the assets generate, but they don't look at assets. But some of these programs can do so much, provide so much help. So when you meet with us, we're gonna ask you, would you mind telling me what your income and assets are? Because we're trying to see, is there something we can hook you into that's gonna lower some of your costs? And we have great luck with this, don't we? That's our favorite part of this job, is getting somebody on a benefit program. Okay, we've covered all the bases, I guess, haven't we? Okay. Thank you for listening.
And please, yes, Maureen cooked this beautiful cake. Please do not leave without having a piece of cake. And it says, if she comes here this afternoon and sees cake, she'll be really mad at us that we didn't serve it. So we have vanilla and chocolate.